Hi everyone, I'm Dr. Sherazad, your Dr. Bestie, and your friend in medicine. Today we're jumping back into the Pitt, HBO Max's amazing medical drama turned into ER reality. We're back with season 2, episode 1. In this episode, we're going to talk about the gruesome sounds of the ER and learn a new checklist. If you have an elderly parent, you're going to want to learn my Pinch Me checklist. Let's get into it. Ooh, I see Langdon. There he is again.
I need a priest.
Hey, Dr. Robbie.
What's a good word, Perla?
All your results came back normal, Mrs. Walker.
I'm dying.
You're not dying, Mrs. Walker, I promise.
Jesus is coming for me.
What you're witnessing, ladies and gentlemen, is a full-blown panic attack that can happen so frequently and so easily. It's happened to me before. And I didn't know I was having a panic attack until my mom gently told the nurse to give me something to relax, which they didn't, but they sent me home with stuff. And 3 years later, I never filled the prescription, but realized that I was given medication for a panic attack. And I was like, that was a panic attack? It took me that long, and I was a doctor at that time and attending. So, full-blown panic attack. You could see it all over her face.
It is a patient passport.
So glad you asked. Samira. Dr. Al. We worked together at the VA a few years ago, and now you're in R4.
Yes, and I'm so excited you're joining us.
Okay, so Samira's in R4 now. That's great. This is the new attending. That's amazing. They already know each other. I don't know how frequently that happens, but maybe at like the community hospitals in New York, because med students rotate in different hospitals, that could happen.
John Doe, dishwasher, penetrating trauma from a kitchen knife to the right chest.
Fortunately, he also likes to use other people's toothbrushes.
It was one time. They were the same color.
What's your plan, Samira?
Did they live together? That'd be kind of crazy.
You should be good to go now, hon.
Thanks, Lupe.
They probably like drug testing.
Go get him.
Yes, go get him. I like that encouragement, Lupe. I really like that.
The prodigal son returns.
Wow. She landed that line. And in the clips for the Pit, it was actually Robbie's face that showed up when she said that.
The prodigal son returns.
But this is for Langdon, so I just love that she landed that line.
Now let's fill the tank. You are very popular today.
Sorry, I'll turn it off when I can.
Okay, he's in like cardiac massage with his heart. One time when I was a resident, I responded to a code blue in the cardiothoracic ICU because I was nearest. And I was kind of just quick. Whenever I heard code blue, I would like go to help immediately. And I got there before a lot of the cardiology fellows, and I was an internal medicine resident, which means I don't have this specialty they have. And the patient that was coding was a patient who had literally an open heart. The sternum was open, cavity was open, and they were in the room. The attending got there, and I was there, and he was like, massage the heart. And I was like, with my hand? And he was like, yes, intracardiac massage. So I put my hand inside the chest cavity and literally got to squeeze this heart. And then the fellows started showing up, and they all were like kind of looking at each other like, who is this person? Because we don't have it that much interaction with the cardiothoracic team. Then the attending was like, are you a fellow? And I was like, no. And then he was like, get out of there or something. Like, it was like way beyond my scope, but it was so cool.
My family's Hindu, so we have like 33 different kinds of deities.
We have the one.
Some people only need one, right?
Woo, punchy. Not gonna jump into that, but I love that they even showed that on the show. That nun had a gnarly case of conjunctivitis. Conjunctivitis can be bacterial, viral. Most likely it's viral. Most commonly it's viral. But that conjunctivitis looked pussy. It looked bacterial. Not that all pus is bacterial, but still. That conjunctivitis needed to be cultured. And she did an amazing slit lamp examination to see if there's anything stuck in the eye. Also, this lady could have had a corneal abrasion that got infected. Corneal abrasions are when there's like a chemical burn or even a physical burn. I one time got my eyelashes done and they poked me with the little device and it went on my eye and then I had a corneal abrasion. My eye couldn't stop tearing and it hurt so much. Like I had to keep it closed. And that's actually happened to two of my family members. Well, within the past like 3 or 4 years, they didn't get their eyelashes done. One of them poked their eye by mistake and one of them put their contact lens inside their eye before it was time to remove it from that really, really chemical burny, Costco lens cleaner. There were different reasons, but I didn't get my eyelashes done after that again.
Clear everything up, but you should try to stay off it for a few days.
I have to work.
I'm late as it is.
Well, take breaks and elevate when you can. Tylenol and Advil for the pain. If the pain persists or feel like it's getting worse, come on back. We'll get you fixed up.
Okay, she has lower extremity cellulitis or leg cellulitis. Cellulitis is a very simple skin infection. Infection of the skin is usually staph or strep. The treatment, yes, antibiotics and pain relievers, but he said stay off your feet if you can, but it's truly stay off your feet, especially the first few days. Because if you think the redness is going to get better, but you're standing all day, it's not.
What the hell is it?
Patient passport. Lets patients know what they're waiting for and how long it'll take. You check off if he needs labs, x-ray, CT.
None of the above. When do we start this?
Today, the new attending.
Patient passports are apparently given to patients in the ER so that they know the roadmap of what it's like to be there. Patients are stressed, they're confused. It's like the zoo at the ER. So the patient passport was designed to fix that. And it is supposed to reduce the bounce back rate, reduce the malpractice risk, improve the patient comprehension and communication. 90% of the time, patients forget 90% of the verbal instructions. Actually, I know somebody who would ask the doctor if they could just record what the doctor was saying so they could hear it again later because they knew enough to know that they couldn't hear it all the first time. And it is a lot. It is new. But an ER passport will tell you how long CT scan would take, how long blood tests will take, and what to expect.
What's up with your tooth, Louis?
It's been going on for a while, but it got bad last night. Lower left side.
Okay. It could be an infection at the root.
Ladies and gentlemen, this is a tooth abscess. Heavy alcohol can significantly increase the risk of abscesses. Abscesses happen when people neglect their dental care. A tooth infection is really serious. A gum infection is even more serious. You need to go to the dentist ASAP. They need to drain it ASAP. They need to be on antibiotics. Interestingly, there were some studies that showed that good oral hygiene is linked to good longevity practice.
You're breathing kind of fast.
Yeah, I've been walking more, trying to get in shape. But sometimes I get a little short of breath.
Yeah, you need to walk past the liquor store, not into it. 10 months ago, I treated you, and I took some of your medicine.
Woo!
I'm not sure I follow.
Let him know.
I have an addiction to benzos.
Would you tell your
I
patient?
helped myself to some of the Librium I prescribed you for your withdrawal.
You stole my pills?
Good for you, Langdon.
Yes.
Woo!
I'm sorry. It was not only wrong and utterly unprofessional, but it was a betrayal of my Hippocratic oath, and it was a fucking crime. That's where I've been. Rehab and counseling.
This is insane. My jaw literally dropped. I was amazed by the bravery and integrity that Langdon shows here. Humans are all flawed. Nobody's perfect. The fact that he can face the person that he wronged is so admirable. I can see myself in that. I'm often the first to admit when I'm wrong. And sometimes when I say things that I don't believe, I'll quickly go, I'm not really sure about that. I'll have to double check that. Doctors need an extremely high level of integrity. And the key is that both parties understand.
Hyler flip. You're gonna rotate the lung 180 degrees, like putting a kink in the garden hose. It'll stop the bleeding.
That could possibly work.
Or he'll die when you rip the entire lung off the hilum.
That's crazy. They're talking about flipping the lung this way, vertically. You know, the ones that are right here. I don't know a lot of these ER procedures or surgeries or whatever, but definitely that one is insane.
Reversible causes of confusion in the elderly.
Hypo or hypernatremia, infection, but he's afebrile, got our 2 sats, and urine dip was negative.
Yeah, great.
This is cool because this question is so important, like the most common causes of altered mental status, because so commonly the elderly can get a little confused and you wonder, like, are they just old or is there a reversible cause? The most common cause is infection, and the urinary tract infection at that. So I came up with this mnemonic to kind of help you figure out the triggers of confusion, especially if you're an adult child of an elderly parent. So it's pinch me. P is for pain, uncontrolled, and that could trigger some confusion. I is for infection, like a urinary tract infection. N is for neuro changes or nutritional deficiencies. So neurostatus like a stroke or TIA, or a nutritional deficiency like B12 deficiency, folate deficiency. C for constipation or urinary retention. Those two can cause severe confusion. Even though the tracts aren't connected, like the gastrointestinal tract, and the genitourinary tract. The C for constipation can also lead to urinary retention, and both of those can trigger confusion. The H is for hydration. Dehydration is a very real problem in the elderly. Like, they don't drink a lot of water, especially little old ladies, because they don't want to run to pee. They don't want to pee themselves. Like, urinary incontinence could happen very quickly. So they end up just not drinking water. M, we're at the M for pinch me. M is for medication effects. Like, if they are taking Benadryl or any anticholinergic, it's so easy for them to get confused. Very basic things. E is for environment, like not sleeping too well, or if they missed their hearing aids, they just forgot to put them in that day, they can end up looking confused and sounding confused. So the environment is so crucial and key for an elderly to keep it consistent. These are all treatable triggers of confusion. The pinch me. E for pain, I for infection, N for neuro changes or nutritional deficiencies, C for constipation or urinary retention, H for hydration and dehydration, M for medication changes, and E for environmental changes.
Joy, anything to add?
Nah.
So this episode of The Pitt is packed with real-life moments, anything from confusion in the elderly to a lung flip. Just kidding, that's not very common. End-of-life decisions, hard conversations with families, the quiet emotional load that doctors carry behind the scenes, Langdon owning his abuse. If you have an elderly loved one, I hope you use that pinch me mnemonic and share it with your friends and family. It's a practical tool. Whether as a patient or a family member or a healthcare worker, you're not alone. We're all just trying to make sense of these really hard moments. If you like this breakdown and want more, no BS medical reactions, check out my other Doctor Reacts to Pitt videos here. And let's keep learning together. Own your health, own your future.